Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering all subjects. So guys, anything that you expect to see on your HESI exit, your ATI exit, NCLEX, I'm covering just a variety of topics for this video. If you haven't done so already, guys, please don't forget to like and subscribe below. Guys, please don't forget, I'm now also on TikTok and Instagram. My handle is still the same, Nexus Nursing. I have a podcast for nurse practitioner students. If you're in the program and you kind of feel overwhelmed, I'm on most of the major streaming platforms. Look for Nexus Nursing, and I cover the content, the topics you're definitely going to see on your exams, but you'll definitely see on your state test. Whether you're testing for AANP or ANCC, I got you covered. Also, if you're a nursing student and you're struggling, you need some extra help, go check out my website, nexusnursinginstitute.com. I have audio lessons for basically every single subject you can imagine. I'm adding every week. So if you go on there and you don't see the content that you specifically need, keep checking, because every week I'm uploading new courses. All right, guys, without any further ado, let's get started. First question. The client's being admitted for surgery. During the admission assessment, the client states that she usually has 8 to 10 alcoholic drinks a day. How should the nurse reply? 1, what type of alcohol do you drink? 2, how long have you been drinking alcohol? 3, when was your last drink? Or 4, why do you drink so much? And guys, the correct answer is 3, when was your last drink? This is very important for us. Number 1, we always want to know when the patient's last drink was if we suspect that they're a chronic alcohol user, because alcohol withdrawal can be deadly. That's number 1. Number 2, this patient's about to have surgery. What do we know about alcohol? It can cause what? Bleeding. Do we want that patient bleeding out on us on the table? Absolutely not. So that is definitely going to be one of the first questions we ask of the patient. Next question. The nurse is caring for a woman who had a mastectomy following a diagnosis of breast cancer. When the nurse enters the room, the curtains are drawn and the client is lying with her body turned towards the wall away from the nurse. When the nurse approaches her, the client says, "Just leave me alone. I'm no use to anyone. I'm not even a real woman." How should the nurse respond? 1, leave the room. 2, open the curtain. 3, say, "You sound upset." Or 4, say, "Women are more than breasts." And guys, the correct answer is 3, say, "You sound upset." Observation, guys, is a form of therapeutic communication. You're telling the patient what you're observing, and you're giving them a chance to express themselves. You're allowing them an opportunity to say how they feel. So you want to have a therapeutic approach. You don't want to leave the room. That's not solving the problem. You don't want to open the curtains. What's that going to do? And you don't say women are more than breasts. You're basically giving advice, but you're also diminishing the patient's feelings, and you want them to express their feelings, because the more they're talking, the more you're listening, and the more you're listening, the more you know what things the patient is saying incorrectly, that you can give them factual statements. Okay, next question. The nurse is providing home care to a 78-year-old woman who has early dementia. The client tells the nurse, "My daughter's so mean to me." What should the nurse do initially? 1, report suspected elder abuse to the supervisor. 2, report elder abuse to authorities. 3, ask the daughter about the mother's comments. Or 4, ask the client to describe what the daughter does to be mean to her. And guys, the correct answer is 4. You're going to assess, get more information. What if she considers mean to be the daughter not allowing her to light a cigarette right next to the oxygen machine? What if mean is the daughter not allowing her to eat ice cream every day and she's a diabetic? So the first thing you're going to do is assess, get more information. You're going to ask the client to give you examples. What is she doing to be mean? And then from there, you know if you have to report abuse or not. And if you have to report abuse, you're going to go directly to your supervisor. Okay. And then your supervisor is going to reach out to the authorities. You're not going to go directly to the person you suspect of abusing the patient in the first place. Next question. The nurse is inserting an indwelling catheter in a female. The nurse knows that the urethral meatus is located where? 1, between the clitoris and the vagina. 2, between the vagina and the rectum. 3, above the clitoris. Or 4, below the rectum. And guys, the correct answer is 1, between the clitoris and the vagina. That's where you're going to insert the catheter. Next question. The nurse is preparing an adult male who is diagnosed with probable appendicitis. Which assessment finding is most consistent with this diagnosis? 1, pain in the right upper quadrant. 2, decreased WBCs. 3, nausea and vomiting. Or 4, high fever. And guys, I'll give you a moment to think of your answer while I sip on my coffee. Okay, guys, so the correct answer is 3, nausea and vomiting. That's what you expect to see in the patient with appendicitis. Now, let's look at our wrong answer choices. 1, pain in the right upper quadrant. If the patient has appendicitis, we expect to see pain in the right lower quadrant, so that's incorrect. 2, decreased WBC. No, we expect those WBCs to be elevated. And then 4, high fever. We expect that patient to have a low-grade fever. Now, if that appendix ruptures, then they're going to get a fever, right? Because that has turned into what? Peritonitis, medical emergency. That's a whole other subject. But for just suspecting the appendicitis, we expect that patient to have a low-grade fever. Next question. How should the nurse position the patient who has just had a liver biopsy? Excuse me. 1, on the left side. 2, on the right side. 3, semi-sitting. Or 4, semi-recumbent. And guys, the correct answer is 2, on the right side. Why? You want to place the patient where they had that liver biopsy. The liver is a very bloody organ. So you want to put pressure on that site to help decrease bleeding, okay? An adult is to have a paracentesis performed today. What should the nurse do before the procedure? 1, encourage the client to drink large amounts of fluid. 2, ask the client to empty the bladder just before the test. 3, keep the client NPO until after the procedure. Or 4, pre-medicate the client as ordered. And guys, the correct answer is going to be 2, ask the client to empty the bladder just before the test. Why? We want that bladder to be flat. We don't want any urine in the bladder, just to make sure when that needle's inserted, it doesn't accidentally puncture the bladder. So we ask the patient to empty their bladder. Next question. The nurse observes a certified nursing assistant placing a hot water bottle directly on the skin of a 90-year-old client. What action should the nurse take initially? 1, report the act to the patient care supervisor. 2, interrupt the procedure. 3, talk to the CNA when the procedure is finished. 4, notify the physician. And guys, the correct answer is 2. You're going to interrupt the procedure. Why? That CNA is about to put a hot water bottle directly on the patient's skin. You want to prevent that patient from getting burned, so you're going to interrupt this procedure. There are some things you can wait until the CNA is done, and the only time you wait until CNA is done is if the CNA is not doing something to harm the patient. Anything that will harm the patient, you will stop that procedure in the middle of it. You will stop them, okay? So number 2 is the correct answer. Reporting it to the nurse supervisor. You always want to talk to the CNA first. You might have to report it, but that's still not going to be the first thing you do. You're not going to wait until the CNA finished burning the patient to talk to the CNA, and there's no need to notify the physician. That's what they have supervisors for. So number 2 is the correct answer, because you always want to have a barrier on that skin. You don't want to put anything extremely hot or extremely cold directly on the skin. The nurse is planning care for all of the following clients. Which client should be cared for first? 1, a 60-year-old with 3 days who's 3 days post-op and needs dressing change for ambulation. 2, a 75-year-old who had a suprapubic prostatectomy yesterday and says, take that tube out of me, I have to pee. 3, a 90-year-old who had a total hip replacement 2 days ago and is to get out of bed today. Or 4, a 50-year-old who had abdominal cholecystectomy yesterday and is asking for pain medication. And guys, whenever you get a question about which patient you're going to first, what they're really asking you is which patient is a priority, which patient is in the most danger. Number 2, why would a patient that has a catheter say, get this out of me, I have to pee? That catheter is supposed to automatically drain any urine that's coming out of the bladder. So if that patient feels like they have to pee, you better go assess that patient, because there may be some kind of blockage. That urine is not draining, that bladder's getting full, and that's why the patient has to pee. And the last thing you need on your hands is a ruptured bladder. That's poor nursing care. You're going to mess around and lose your license. Okay, moving on. An adult is admitted with advanced cancer of the GI tract. Which question must be included in the admission assessment? 1, what foods do you like best? 2, do you have an advance directive? 3, do you want CPR if you go into cardiac arrest? Or 4, do you understand the serious nature of your illness? All right, guys, and the correct answer is 2, do you have advance directive? They're admitted with advanced cancer of the GI tract. Advanced. So this most likely is terminal. We need to know if they have advanced directives, so we know what the patient's wishes are if they get to a point where they cannot speak for themselves. That's going to be the priority. The nurse is providing home care for an immobile client who has a stage 4 decubitus ulcer that's not healing. Assuming that all of the following are available, which person would be most appropriate to consult regarding care of the wound? 1, physician. 2, physical therapist. 3, IV therapist. Or 4, enterostomal therapist. And guys, the correct answer is 4, enterostomal therapist. This is a wound care specialist. So the wound care specialist is the person that you will go to see how to best care for that wound, that ulcer that's happening with the patient. And guys, they do ulcers, they do stomas, any opening in the body, any wound, that is who you would refer to. A woman reports to the physician's office complaining of urinary frequency and pain and burning upon urination. The nurse expects which procedures will be ordered for this client. 1, urine culture and sensitivity. 2, CBC and BUN. 3, routine urinalysis. Or 4, BUN and creatinine. And guys, the correct answer is urine for culture and sensitivity. We want to see what's in that urine, what kind of bacteria is growing, and what kind of antibiotics will be sensitive to that bacteria so that the patient can get the correct medication. So the correct answer, guys, is number 1. Number 2, CBC. You're going to check patient CBC if you're suspecting maybe they're bleeding. You want to look at the hemoglobin, maybe anemia. BUN, we'd be looking at kidney function. Routine urinalysis. A urinalysis will let us know if there's bacteria in the urine, great, but it won't tell us what's growing and what it's sensitive to. And choice number 4, BUN creatinine, that tells us the kidney function. But for this patient, we're suspecting a urinary tract infection. So for that patient to get treated, the doctor is going to need to know what pathogen is growing and what that pathogen is going to be sensitive to. A 38-year-old client who has mitral stenosis is hospitalized for valve replacement. Which condition is the client most likely to report having? Which condition is the client most likely to report having earlier in life? 1, meningitis. 2, syphilis. 3, rheumatic fever. Or 4, rubella. Oh my gosh, guys, this is a famous nursing test question. You got to know this. And the correct answer, guys, is rheumatic fever. This is the most common cause of mitral stenosis. Patient having rheumatic fever, and later down the road, they develop mitral stenosis. Okay, so that's the correct answer. Now let's talk about the other answer choices. 1, meningitis. This is a type, this will cause neuro issues. Meningitis, guys, that's, I'm sorry, I'm having so many brain farts today. Infection, that is an infection of the brain and or a spinal column. So we would expect to see neuro signs and symptoms such as confusion, such as the stiff neck, photosensitivity. By the way, if you even suspect meningitis, you'd be putting that patient in isolation. Choice 2, syphilis. With syphilis, we tend to see more cardiac signs and symptoms. With rubella, oh yes, rubella is number 4. Rubella in the mom can cause cardiac defects in the child. But for this specific symptoms where it says cardiac valve replacement, we're going to go with rheumatic fever. We would expect that that patient had rheumatic fever in the past, because we know that when somebody has rheumatic fever, that later can turn into mitral valve stenosis. Following cardiac surgery, the client's urine output for the last hour is 20 mLs. The nurse should understand that this indicates the following. which of the following? 1, possible hyperkalemia, 2, insufficient cardiac output, 3, inadequate fluid replacement, or 4, diuresis is occurring. And we know it's not 4, guys, because it said 20 mLs. So the correct answer is 2, insufficient cardiac output. What is the minimum ml supposed to be for urine output? The minimum is supposed to be 30. So if the patient's having 20 mLs, let me tell you what happens. Whenever there's not enough fluid in the body, patient's going through dehydration, organs start to shut down because your body is meant to survive no matter what. And so the organs start to shut down because it's trying to conserve. And the first thing that shuts down is the bladder. The bladder's trying to hold on to all the fluid it has because it already doesn't have enough. So it's not trying to let any go. So when you see that urine output go down, you better suspect cardiac output insufficiency. So the correct answer, guys, is number 2. A 20-year-old woman is admitted to the hospital following an accident. Her uncle, a doctor from out of state, visits her and asks to see her chart. What should the nurse respond? 1, comply with the request and give the chart to the physician. 2, explain that written permission from the niece is needed first. 3, suggest that he discuss the case with the attending physician. Or 4, give him the chart, but do not let him remove it from the nurse's station. And guys, the correct answer is 2. If that doctor is not working in the capacity of caring for that patient, they do not have rights to that chart. You have to respect the HIPAA laws. And guys, I hate when you as students write HIPAA as HIPPA. No, it's not a hippopotamus. It's HIPAA, HIPAA. Okay? So you have to is hippopotamus spelled with 2 P's or 1 P? I don't know. But the point is HIPAA. You have to follow the HIPAA laws. So you have to explain that there has to be written permission from the patient in order for the physician, uncle or not, physician or not, to be able to have access to the chart. An adult is admitted for surgery today. Immediately after administering the pre-op medications of meperidine and atropine, the nurse notes that the operative permit has not been signed. Which action should the nurse take? 1, have the client sign the operative permit immediately before the medication takes effect. 2, have the client's next of kin sign the permission form. 3, ask the client if he or she is willing to undergo surgery, sign the form for the client and indicate the nurse's name as witness to the client's verbal consent. Or 4, report it to the physician so surgery can be delayed until the client can legally sign the consent form. And the correct answer is 4. That client is under the influence of drugs. That signature means nothing. Okay. Unfortunately, you have to call the surgeon and let them know that the surgery is going to have to be canceled until the drugs clear from the patient's body. The doctor has to come back in. The surgeon has to explain everything over again. The client has to agree, sign. You guys have to start the process all over again. The correct answer is 4. All right. Last question. The nurse is administering hygienic care to an elderly client in her home. What should the nurse wash first? 1, perineal area, 2, face, 3, upper torso, or 4, hands. Okay, guys, and the correct answer is 2, face. We always go from clean to dirtiest, higher, lower. So we're going to clean the face first. That's number 1. Now, what will we clean secondly? Patient's hands. 3rd, upper torso. And last, down there, the nether regions, the perineal area. Okay, that's the order that we go. Guys, unfortunately, that is it for this video. I hope that you found this video to be helpful. Again, guys, I'm asking you to please help me grow. Help me by supporting this channel, sharing my content with your classmates, with anyone you know that you think would benefit from this content. Please don't forget, I'm also on TikTok and Instagram. My handle is still the same, Nexus Nursing. My audio lessons are now available on my website, nexusnursinginstitute.com, and you can check out my podcast for nurse practitioner students. If you know anybody in the nurse practitioner program, let them know that Nexus Nursing now has a podcast just for them. Thank you so much for sharing this time with me, and I'll see you on the next video.